Hi everyone, my name is Rochelle and I am the clinic director at a physical therapy clinic. It's a pretty busy clinic. We see about 40 to 50 patients a day. There's two therapists and a couple of PT aides that help us out in the clinic. If I were the owner of my organization, I would focus on three specific changes to improve both staff experience and patient care. So the first one would be that I'd upgrade our documentation system. So right now our EMR takes way too long to use. I often find myself working an additional hour every single day to complete patient documentation and notes, especially with all the advancements that we have today, like AI and, voice recognition, dictation. I would probably change the EMR system to something that is more newer because the one that we are using is a little outdated. I'd switch to a more intuitive EMR with voice to text features and templates for common diagnosis. For example, having a pre filled shoulder impingement template would save 10 to 15 minutes per evaluation. That time could go back into patient care or even a well deserved break. It would also prevent a lot of burnout within employees of the clinic. Second would be I would invest in staff development and recognition. People work better when they feel seen and supported, so I'd start a monthly employee spotlight where team members are recognized for great patient feedback or going above and beyond for their patients. I'd also offer a small stipend, maybe like $1,000 a year for specialty training, which wouldn't just be limited to physical therapists or occupational therapists of the company. It would also be given to, the receptionists or PT aides that we use. The third thing that I would do would be I'd revamp our scheduling and patient communication system. No shows and last minute cancellations throw off the whole day. Sometimes we're scheduled for about, let's say, a PTS to see about 26 people a day, and 11 of them cancel. So that makes it 15 people where we could have used those time slots to give other people appointments and they could have gotten treatment. We also see a lot of last minute cancellations. Emergencies are fine, but a lot of people are also just not regular or particular about their appointments. We also have people who come in really late and then we have to accommodate them, so it just makes it very hard for the clinic. I'd implement an automated text or email reminder system that also lets patient reschedule in real time instead of just sending them reminders and notifications that they have an appointment. I'd also open up early morning or evening slots a few times a week for working patients. I know that a lot of physical therapists in our clinic like to have a specific time. So if someone likes working 9 to 5, they don't like moving it around, but maybe I'd introduce a system where maybe 3 days a week they could do 9 to 5, or and then 2 days a week maybe they could do a 10 to 7 to kind of increase patient numbers. A 7 p.m. slot, let's say on a Tuesday, would really help people who can't get off on time at work. We do see a lot of working class people, so early morning appointments and later in the evening appointments would also like boost our clinic numbers. It's a small shift, but it shows flexibility and patients appreciate that. These changes might seem simple, but they address real everyday problems. Faster documentation means more time with patients, recognition and development, build a loyal, motivated team, and smarter scheduling improves patient satisfaction and clinical revenue. So if I was the owner, I'd focus on creating a clinic where both staff and patients feel valued and heard, because when people are happy, your outcomes improve. People will show up more if they feel good, and there would be less burnout, and PTs would be happier in general to be treating. Thank you for listening.